For initial fitting of the flex elbow or with change of condition, you want to loosen the hinges by unscrewing the knobs on each side and simply lay it over the patient's arm. On a normal day-to-day donning, you will not change the degree but simply put it on and take it off. You want to smooth any of the material the patient may be wearing. Start the splint up a little higher than the patient's actual elbow joint. It will work down just as you're fitting it. Bring the straps to the elbow cap up between the patient's arm and the sidebar. Divide them and hook them onto the sewn-on loop. It makes your material last longer. Center the elbow cap. Make sure there's no pressure by running fingers above and below to secure the cuffs. Smooth the material around and bring the black straps up and hook them also onto the sewn-on loop. Do the same with the bottom, and if you want to make it a little more snug, you would simply squeeze it with your hand, and you can bring that up. You can also heat mold it, larger or smaller. To set the degree, which is only done on initial fitting or change of condition, you want to open the device until the ligament pops up. There's about 5 degrees between each tooth. You're going to extend it 5, 10, maybe 15 degrees and lock it down. Typically, the more tone or spasticity a patient has, the slower you're going to go. You can regulate the extension quite a bit just with the wings of the straps on the elbow cap by tightening it and pulling the patient's elbow farther into extension. Repeat with the other hinge, cover it with padding, and your patient's elbow is on.